you a woman in medicine feeling overwhelmed and disconnected from the personal fulfillment that you desire? You're in the right place. Join Doctors Joanne and Aaron as they rewrite the rules for women in medicine. Let's begin.
In this episode, I'm excited to introduce Dr. Jill Pearson as the guest with Joanne and I. I've known Jill for 30 years. I know how amazing she has been in her pediatric medical career, and I'm so excited for you to hear some of her inspiring stories that help us learn how to do medicine that works for us. And when it's not being presented, Jill knows how to create the way herself. Welcome to the show, Jill. I'm so happy to have you here. And I'm wondering, for the listener, help us best understand what you are an expert on.
Oh, thank you so much, Erin. It's really great to see you in this format. And yeah, one of my longest-standing friends. So what a treasure to be here with you. What am I an expert on? I am an expert in pivoting in medicine. I think that's one thing that I really hold near and dear to my heart. I think this started about my career down in Roseburg. So Southern Oregon is where I started my private practice. I was down there for 14 years and was telling my soon to graduate older boys from high school, you could do anything you want to do, anywhere you want to do. Just make sure you're happy with the people you work with, what you're doing and where you are. And kind of looked at where I was, loved what I was doing, didn't really love where I was doing it. So that was the beginning of my pivots. Felt like I wanted to do some exploring in medicine and see what else was out there. And that's when I moved up to the Silverton area.
Love that. And actually, you've done multiple pivots, and we're going to get to that. But that question you asked about love where you're at, love who you're with. What did you say again? That was just so powerful.
Yeah, love what you're doing, where you're doing it, and who you're doing it with.
Mm-hmm. And that led to some introspection. So powerful.
Yeah.
I love that. Thank you for being here with us, Jill. And when we were getting ready for the podcast, we usually do kind of like a pre-interview that we should start recording because it's always filled with gems. You talked to us about how you're a fierce advocate for children beyond what you do already as a pediatrician. Tell us about that.
Oh, yeah. I think that is basically my mission. When I left my last job as a medical director for the Salem Pediatric Hospice Program, my mission was really advocating for children and catching the children that were falling through the cracks of our broken healthcare system. And so that's kind of my resounding go-to statement whenever I'm making a decision about where to go. And it's really led to ongoing open doors, which has been a beautiful thing.
And I'm just going to highlight, Jill, what I know about your practice, because we've stayed in touch over the last 30 years, and we actually live in pretty close proximity to each other. You have helped create things that haven't existed before. And I really want to point that out to our listener because you did general pediatrics for 14 years, you said. And then the career pivots you've had after that, there was something that didn't exist and you created it. And I would love to hear, as you are a fierce advocate for children, can you share with us one of the programs you created that didn't exist that helped you find the career path that was right for you during that time in your life?
Absolutely. I think the one that comes to mind is directing the creation of a new pediatric hospice program at Salem Health. I had the privilege to be invited to do that be in that position and create a team of like-minded doctors and educate nurses and respiratory therapists and just bring a culture of excellence in pediatric care to a community hospital. My passion there was to be able to create a program that was excellent in providing medical care, allowed children to stay in their community when they required hospitalization, which comes with a huge amount of support for families during a terrifying time of parenthood when their kids are in the hospital.
And that's just one of the many areas that I know. Can you expand? We had a conversation recently about the NICU babies and some of the programs that you dealt with. And as Joanne and I are both deeply entrenched in trauma and how it affects people. And not everybody's medical path gets that dose of it. And I would love to hear how you took your fierce advocacy for children and also then helped not just create this hospitalist program so families could stay local and get high quality care, but you created a new program for the NICU babies who were struggling, and made a system that was so much better. And I would love for you to share a little bit about that and how it advocated for what the need was for these
absolutely
patients without a voice.
Yeah, absolutely. So you're probably referring to the babies that are what we consider now as babies. So the neonatal opiate withdrawal syndrome. Obviously, the opiate epidemic has hit Salem very hard, and the unspoken victims or the unintended victims of this opiate crisis are newborns that have been delivered after a pregnancy that is crippled by the use of opiates. And we took care of a lot of those babies in the hospital, and I was able to use evidence-based practice and upgrade our care of those kiddos to move from an outdated Finnegan scoring system, which is a big complex conversation, and move towards a more updated version called Eat, Sleep, and Console, where we were able to improve so many things with the care of these babies. Number one, using a trauma-informed lens and bringing parents to the bedside. So no longer were these babies going to the NICU after delivery if they were suffering from withdrawal syndromes, but they were going to the pediatric unit alongside their parents. So trauma-informed care, parent-engaged care, parent and family-focused centered care was really a passion of mine. And then also we were able to decrease the length of stay for these families and then also decrease morphine utilization. So huge amount of improvements in the care of these families. The nurses felt like they were doing a better job and had more job satisfaction. The physicians really jumped on board and were able to implement this improved care package for these families. And overall, we walked away with a great system of care for these families until fentanyl hit our community. And then fentanyl really unraveled these babies. Babies that were exposed to fentanyl during pregnancy really struggled desperately. It was really heart-wrenching to watch. And I feel like it really turned on a light in my head that I wanted to do more in terms of prevention. And that actually has led to my new career pivot, which is really tackling from a grassroots perspective substance use in our area.
That is so impressive. And as a psychiatrist, right, like dealing with those problems with addiction on the other side, on the adult side, knowing there's a fierce advocate for these babies too, that there's just so much that we can do in one area, knowing that you're looking at it for a population that maybe feels like they're not well taken care of, or like there's not enough resources to know there are, and what is not available yet, we can still create. What a beautiful example of creating what's not there yet, and then saying this is, we can feel your passion and knowing that this is important. And then the other thing that you mentioned earlier, which I would love to hear a little bit more about it, is how you support the mothers as well. Even though the identified patient is the baby, the newborn, as a pediatrician, like you were saying, you create a system. So how have you been able to support the mothers and the families?
Oh, thank you, Joanne, for that amazing question. Yeah, that is really pinnacle to this whole jump of faith or leap of faith into this world of substance use, which I really didn't know a whole lot about years ago. And so watching these moms who suffer from substance use disorder, they come to the hospital with a lot of shame, a lot of trauma, a lot of fear. And so I was able to kind of create a pathway for them to come into the hospital setting in a non-judgmental way. So they felt like there was a team awaiting them when they delivered. There's a lot of moms with substance use disorder that are afraid to even get prenatal care for the judgment and the fear that they'll lose their babies, and it prevents them from getting excellent medical care. And I guess my big message is, if there's a mom out there with substance use disorder is not in treatment, there are some amazing treatment centers in our local area that will get them in same day. And the proof is in the pudding. Like, I have watched babies exposed to fentanyl. They do terrible after delivery. But babies that are in a safe medicated assisted treatment program and on methadone, do so much better. They do so much better. And those moms can receive services and wraparound care and be surrounded by people that care about them and will walk them through a much safer pregnancy. So the care of that baby really begins with the care of that mom during pregnancy. And voice or a shout out to my colleagues just to, be curious and learn about trauma-informed care and help these moms understand that there's resources available and accessible. She won't lose her child necessarily, and there's great resources out there and proven systems in place in our community. So I guess that's my big message is help the moms, help the babies, and be the voice for those babies and moms.
And you bring up such an important point. I call it like a trauma lens. After working 10 years in child abuse medicine and recognizing how trauma affects the families and then also secondary trauma to healthcare providers and the healthcare team. And yet I can't look at anyone anymore without using that trauma lens. And when you can interact with individuals, as you said, without judgment, and they're already feeling that shame and they can come to a place with non-judgment, that has been such a powerful tool in so many circumstances, I think for all three of us, whether we're coaching a physician who feels shame about things and we can support them in a non-judgmental way, or these mothers who I'm assuming many of them have experienced much trauma in their lives, which led to their addiction. And that opens the door to this question for you. I feel like your biggest and most powerful pivot in medicine, Jill, is if you can share with us what your current pivot is and how your dream of really providing the care that's not currently in existence for these most at risk babies and mothers and what that looks like.
Right. Thank you, Erin. I jumped ship from Salem Health. I had been there and created a beautiful program with some incredible physicians and nurses and support staff that are taking amazing care of children, but felt like I wanted to touch more lives and really elevate the voice of children in so many different ways. So I wanted to impact more kids from a grassroots level. So again, with my mission aligned with catching kids that are falling through the cracks, I was invited to consult with the Marion County Health Department to work on their substance abuse prevention campaign. And so there I am sharing education to my colleagues in the front, on the front lines in the trenches, caring for kids and families to prevent substance use from pregnancy to children exposed through drug trafficking, human trafficking, all the way up through adolescents getting a hold of things that they didn't know. And so I just want to be a voice of sharing education, sharing resources, being in private practice for so long and continuing to stay in touch with some dear colleagues still in primary care. I know how hard it is, and the challenges continue to grow to the point of burnout for physicians. They don't have the bandwidth to continue to take on new things like teach me about adolescent substance use. Like I want to take on that challenge and bring it to their front door so that they can do a better job, feel informed, and feel like they can continue to advocate for their patients. So I've been jumping out of my comfort zone daily, doing things that otherwise I wouldn't do because I feel like those children's voices need to be elevated. So I've spent the last couple of weeks going to the Capitol and talking to senators and representatives and advocating for children. Pediatricians are meek and quiet and humble by character, and I feel like it's time for us to roll our sleeves up and get dirty and be able to, as physicians, speak to the voices of women and children, and really, identify bills that are being decided upon that will further impact food for children and women, resources, education. Provide, training for frontline staff, et cetera. So that's been really rewarding. I really feel like building community will always be an important thing for children needing to be raised in safe communities and households. So again, working on building communities wherever I see there is a need, from teen moms struggling to raise little kids when they're growing up themselves. Like, why can't we just bring those moms together and build community and help them, learn these positive ways of interacting with their babies that maybe they didn't receive in childhood. So again, thinking outside the box is one of my superpowers, and bringing that to reality by connecting people who I know share the same vision.
I love that. I love when like I feel it all over my body, like your words. I can feel how important this is for you. And our listener might be thinking, wow, that sounds amazing. I wish I could do something like that, because a lot of us have ideas of things that we would want to do different, or we feel kind of stuck in that kind of linear path of medicine, and we have ideas, but then we don't always take action. And one of the messages is we don't have to do this alone, right? So and I know that one of your other superpowers that you shared with us is the like, we love to talk about community, like you just said, the power of community and building teams. So how do you take it from idea to action and incorporate team in it?
Yeah, that's a great question, Joanne. I learned early on just to kind of, I guess, be open-minded and chase after things that I feel like I had an educational deficit about, like it's currently been substance use. So I've just been doing a lot of education, connecting with people that share similar passions and seeing how we can align our mission, because we do better in groups. And I think the human in general wants to improve. We want to continue to learn. We want to continue to affect change. I think especially physicians, and if we get stuck in a rut or stuck in a path, it's not a feel-good place to be. I've found recently I don't like ceilings. Like, I like to be able to move around and create, and that the power of creativity and reducing anxiety and depression and all those things is palpable in this current change that I've made. I felt kind of stuck during several times in my career. And I realize I am my happiest when I'm soaring and when I'm chasing after things that I find align with my core values and my mission statements. And so those are the things that just continue to drive my charge moving forward and advocating for women and children.
I'd like to ask a follow-up on that, Jill, because as I shared, you and I have stayed connected over the last 3 decades, and you talk about getting stuck. And what raised your awareness to help you recognize you were stuck?
I guess I was feeling unhappy, unfulfilled, restless. Like I get to a place where I feel really restless, and I'm like, why am I feeling restless? And just really taking some quiet times on the trail, running at the falls, like doing things that are outdoors really kind of helped me get back in tune with why I'm feeling restless and really chasing that feeling down. And I guess I was looking outside the window, looking at all these potential opportunities to impact women and children, and things, again, creating support groups within moms with substance use disorder. I recently became a trained infant massage instructor, so I can teach parents how to massage their babies. What a more beautiful way to connect these moms who have a history of trauma with their infant. There's scientific data that shows that it decreases maternal depression. What a scary time in parenthood as a brand new baby in your lap. And these moms could be struggling with trauma, shame, fear. And if I can walk alongside them and show them how to parent with confidence and effectiveness, and teach that baby that their mom is safe and loving, what a beautiful way to build community. And I envision like a room full of similar moms, but that have shared experience. And I want to sit on the floor with them and show them how to touch in a loving way their baby and change the trajectory of their path. And they can only be the ones to change it, but I can certainly walk alongside them and help them along that path.
And you talk about you helping alongside these young moms who may be stuck. For our listener, what are some of the things after you became aware that you were stuck in a rut? What resources did you tap into to get out of that rut?
So I did some coaching. I did some coaching with you, Erin. I also did some coaching with Mel Robbins. I felt like I wanted to dig into courage. I feel like I really wanted to unleash more courage. I know I'm courageous, but I feel like it kind of got buried in the in the last 4 years of COVID and then the respiratory surge and just exhaustion in medicine, I really needed to tear off the bandages that I was putting on and just really heal. And so I feel like I did a lot of personal introspection, a lot of coaching, a lot of time on my own, connecting with people I love, and just doing a lot of, coaching myself. Like, Jill, you've done this before, get back up on your feet and let's get going and do something that's meaningful. And I feel like when we find meaning in our jobs again, we can start soaring again. And I feel like that's been really magical for me.
And that's a perfect transition to the next question. And first of all, again, I'm going to keep on saying the same thing over and over. Thank you. And my eyes are here tearing up just hearing you and your compassion and your kindness and your love and how lucky are the people that you've been able to help and touch. I'm sure that you've changed their lives. So keep on doing that beautiful work and inspiring others. You're inspiring me as I'm hearing you. So thank you. And you said it's a few things already of kind of awareness of where we are and knowing if there's something missing, let's identify it and create it. And as you know, the name of our podcast is Create Meaning in Medicine. How have you created more meaning in medicine for yourself?
So creating meaning in medicine for me has really been taking a leap of faith and jumping out of a comfort zone into a very scary place, which is losing a paycheck, dipping into my retirement, but taking a leap of faith because it's not about the money. It's about the patients I touch, right? And it's about the impact that I'm going to make. And just being proud about the work that I'm doing. So I think that creating a meaning and walking away from something that was comfortable, getting curious, and realizing that I'm most happy when I'm living true to my core values.
I love that. And we interviewed another guest, Dr. Leslie Sanchez-Gottler, and I'm looking to see what episode. Leslie was episode number 76. She also talked about taking that leap of faith, breaking out of those golden handcuffs from corporate medicine and transitioning out onto her own and building a successful practice. And if you haven't listened to that episode and you are wondering what else might be possible, then go back and listen to that episode as well. We can put a link to it in the show notes. And I wonder, the second part of our podcast name is Rewriting the Rules for Women Physicians. And Jill, how are you rewriting your rules as a woman physician?
Oh boy, where do I begin? I guess rewriting the rules is don't be stuck in a rut. Like, live to your dreams and live to your full potential. And be curious, be creative, and be courageous. I think that's my biggest message, especially to physicians that feel like they're stuck in a rut. Like, don't be afraid. Take that leap and go back to your mission. Like, why did you become a physician? What is it that you wanted to achieve in your career? And what do you want to look back at and be really proud about? And what do you want your patients to look like? It can look like anything. I had no idea I was going to be working with babies that were withdrawing from opiates. And so to be able to impact the trajectory of that baby's life, to be able to talk to kids about use of illicit substances and maybe change the trajectory of their life, to working throughout the state of Oregon and being a fierce advocate for children. That's my happy space. And I didn't know that a few years ago. So I guess just be courageous.
This is so lovely, Jill. You've shared so many wonderful things. And I love the message of you don't have to stay in a rut. Find that passion, reconnect with it, have the people around you to build the community to really do what you love. And you shared so many wonderful things. And I love how you were able to identify a need and you created what was needed and move forward. And as if you've been hearing our podcast, you guys know that we love a good framework, and you gave us a beautiful framework in what to do, right? And we always start with awareness and identifying the gaps. And then how you said, I asked for help. We talked about that so often that we're not great at that. And you gathered the tools that you needed that you could apply with yourself. And then you realize, and in this space, I need coaching. So that's amazing. And I love how you mentioned, because we're really good at putting on bandages, and sometimes there's so many that then we lose ourselves in the process, and that you were able to say, and that takes a lot of courage, I need to peel off some of those bandages to really heal, connect with myself again, and then keep on showing up. And, as our podcast name, Create Meaning in Medicine, I love that you said that even before we asked you that, how you knew you could reconnect with that passion and redefining what was meaningful to you in your practice, and how you stayed in alignment with what was important to you and your values, and then how that shows. I mean, I could feel it across the screen here, and I can only imagine how many lives you've impacted and will continue to impact. So I feel like, without knowing you, like, so proud of you and so proud to have you in our show and sharing your greatness. And where can our listener find you?
So I am on LinkedIn. They can find me there. And I also I have an email. That's my business email. I called my new business Pathways Pediatric Consulting, because Pathways is kind of aligned with my mission, right? Creating pathways, getting out of addiction, creating pathways to a brighter future for families and children, and my own pathway. So that email is doc.pwpconsulting@protonmail.com.
And we'll put that link in the show notes, right? And I'm just, for those looking on YouTube or watching us on YouTube, I have your card here because we just met in person the other day, this Pathways Consulting. But you also, can you share a little bit? You have another business, the Baby Bundle, which is so unique. Can you give us a little snippet? Because I don't think many people know that there's a need for this, and you also fill this crucial role.
Thank you for asking, Erin. Again, when I left my last job, I was looking for gaps in the system and trying to catch kids that were falling through the cracks. And one such population were the babies that were born through surrogacy. There are families that come from all over the world to the Salem, Silverton area to have babies that are delivered by surrogacy through infertility, et cetera. And I realized that because our pediatric clinics are so busy and so overwhelmed, it was really hard to find temporary medical homes for those babies while they were here in the States. And so I created a little concierge practice whereby I go see these babies in their home or in their Airbnb for the time that they're here in the States, and provide pediatric care, teaching, education. I can sit with the family for up to an hour and a half if that's what they need, and really spoil them with specialized care, taking their anxieties away, giving them the teaching education they need to feel confident about handling this precious child that's new to their lives, and getting them off to a really good start until they return home to their country of origin.
Thank you again, Jill. And I'll just repeat your words for our listeners. Stay curious, creative, and courageous. And with that, we'll wrap up, and stay tuned because our next episode is coming up.
Do you want exclusive resources and the opportunity to connect with us? Then visit createmeaninginmedicine.com now, where you'll dive deeper into how you can create meaning in medicine. And if you're serious about optimizing your results, take 2 quick steps now. Connect with us on the website and tune in to the next episode.